This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hello, everybody, and thank you for the opportunity to give a medical minute. So many of you, maybe people remember December 2022, there was a lot of headlines, New York Times, CNN, about errors in the emergency department. Does anybody remember that headline? It was basically like, ERs are killing people all over the place. 250,000 Americans die from mistakes made in the emergency department every year. It's not true. It's not true. If someone brings up that study to you, I thought maybe we could give a counter study. And I take no credit for this. This really comes from Matt Bivens in a publication called Emergency Medicine News. And he works in the Northeast, but basically looked at those articles in that study. So that study was commissioned by the AHRQ, which is a federal body that's ostensibly designed to improve quality and patient care. But they pulled their data from a number of interesting studies, which I don't think necessarily reflect the true nature of emergency medicine or how we practice in emergency medicine. So just a couple quick points from Dr. Bivens' review. So the claim was that the more people than the population of New Mexico were harmed every year by people working in the emergency department. With 130 million emergency department visits per year, there's misdiagnosis, adverse events, serious harms, death, and severe disability at rates that were astounding, and it created a lot of pop culture, not hysteria, but certainly reaction. The only problem with that is that the studies that they used actually didn't primarily take place in the United States. So the studies actually took place in 3 countries, notably not the United States, Canada, Spain, and Switzerland, all of whom have very different healthcare systems than us. Most of the patients cared for in these studies were not cared for by emergency resident trained physicians or specialty nurses, the sort of folks in our departments. And they're small studies. The Spanish study just looked at an oddly narrow patient population, 250 bounce back patients within 72 hours to a hospital in the Canary Islands during their busy tourist season. Maybe that's applicable to the United States and our population of over 300 million people, but probably not. And they calculated a miss rate based off of that study. The Swiss study looked at 755 patients where the ER team admitted a patient and the admitting team, when they discharged them from the hospital, had a slight difference. Well, that doesn't mean that they were wrong. It just means that time passed and additional diagnoses came and nuance was found. And in fact, that's just how medicine works. It's kind of an explorative process. So I don't really think that that's an accurate description of a missed diagnosis. And then a Canadian study where they actually took patients from the sickest part of a Canadian emergency department, and there was one missed thoracic aortic dissection, and then they extrapolated that out to all 130 million ER visits in the United States at that rate, which seems to be probably just really, really bad statistics, if not overtly malicious. So all that goes to say is that this AHRQ report has been described as utterly unconscionable, which is pretty strong words, but essentially take everything you read with a grain of salt, because it's not to say that quality isn't important. It's not to say that misdiagnosis doesn't happen and that we're not responsible for being really, really diligent about what we do with patients. But keep in mind that we do take really incredibly good care of patients. We have a highly successful system here. We have incredibly well-trained people. I think that the lessons from this study are that these things do happen, but we have to go through the studies that, in fact, those studies, and just be smart about how we interpret them. So thank you for all the high-quality work that you do and the great care that you take of patients, and let's have a good shift.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.